Many thanks for staying tuned, and we'll begin the news with health stories. Now, World Breastfeeding Week is celebrated every year from the 1st to the 7th of August to encourage breastfeeding and improve health of babies around the world. Basi Taipang reports that this year, World Health Organization is working with UNICEF and partners to promote the importance of family-friendly policies to enable breastfeeding and help parents nurture and bond with their children in early life. Now the report.
Breast milk, especially that yellowish substance that comes out immediately after childbirth, professionals say is the only source of water and nutrients an infant needs within the first 6 months of life. A breakdown shows breast milk contains some valuable nutrients that can decrease respiratory infection, diarrhea, and other communicable diseases. Breastfeeding also contributes to child spacing, as well as decrease ovarian and breast cancer. Despite these gains, record shows that only 27% of lactating mothers give their babies only breast milk in the first 6 months of life, which is below 50% target. These and more inform the 7-day advocacy aimed at creating awareness on exclusive breastfeeding by WHO, UNICEF, and some partners.
So for this year, what we are looking at is ensure that there is a skill counseling services that ensure that mothers and family receive support for counseling and being able to breastfeed. And this counseling is key to ensure that this woman is able to really breastfeed her child very well.
This year's theme, Support Breastfeeding for a Healthier Planet, experts say is apt. The week-long advocacy was also aimed at bringing to an end infant mortality from malnutrition and educate mothers on the need to adhere to exclusive breastfeeding for the first 6 months, as well as continue complementary breastfeeding for 2 years of the child's life. Basi Taipang, NTA News.
And joining us live in the studio to speak more on Breastfeeding Week is the Director, Family Health, Federal Ministry of Health, Dr. Salma Ibrahim Anaskolo. It's a pleasure to have you join us on NTA International News at 7.
Thank you very much, Abdul Malik.
Right. Now, let's start with the theme of this year, which says Celebration Breastfeeding for a Healthier Planet. What informed this theme to start with?
Yes, just as it says, breastfeeding for a healthier climate. Breastfeeding contributes significantly to a healthier climate because when you breastfeed exclusively, you promote healthy environment because you don't use any artificial method of feeding. You use the naturally available, readily available breast milk to feed the baby. And then you don't pollute the environment in the sense that you don't have to boil water, you don't have to boil the food, you don't have to use any form of fuel to prepare the milk for the baby. And then it does not also include any transportations of any items or use of any utensils that you need to wash. So exclusive breastfeeding and breastfeeding of the baby for the 6 months of life without any additional milk or anything is recommended for mothers. And also continue to breastfeed for another 2 years. And then after 6 months, you introduce complementary feeding. So this is the only way we can protect, promote, and also support breastfeeding for healthy babies, for development of the babies. Babies that are breastfed surely are more intelligent than babies that are not breastfed. So we strongly recommend breastfeeding of babies. As soon as they are born, within the first 1 hour of birth, every mother should initiate breastfeeding. That is the most important part of it because the first drop of the breast milk that comes, that is the colostrum, it contains a lot of antibiotics and it boosts the immunity of babies. So we encourage all mothers, irrespective of their status, irrespective of even COVID, we are in a COVID pandemic at the moment, irrespective of COVID, mothers are encouraged to exclusively breastfeed their babies for the first 6 months of life. But if a mother is suspected to be COVID positive, or positive with COVID, The mother is encouraged to observe all the protective and preventive measures.
I like the fact that you're talking about COVID now, because
Yes.
we're still going to get to COVID and having to know what the impact might possibly be and the effect at this time of the moment. Now, it's advisable, as you talked about, having to breastfeed, one's ward and all of that, because cognitive reasoning, agility and strength and all of that. Now,
Yeah.
baby friendly is very much important. What is Nigeria's situation in this regard?
Yes, Nigeria, we have been promoting baby-friendly hospital initiative and now baby-friendly initiative for the past 20 years and above. The whole idea is to ensure that work environment are also baby-friendly. It provides a conducive and enabling environment for mothers or working mothers to be able to breastfeed their babies even at workplaces.
Right.
Creches should be made available at workplaces. We also encourage baby-friendly initiative in the hospitals. This has been known for over 20 years,
Right.
where no bottles should be used to feed babies. No artificial formulas should be used except medically indicated. All mothers should use the breast milk, which is naturally and readily available at the right temperature, in the right composition, in the right amount, because it promotes the health of the babies. It also takes care of the baby, prevents all kinds of respiratory tract infections. It protects babies against having all kinds of diarrheal diseases. So the benefit is not only to the baby, but also to the mother. Research has shown that, and this is evidence-based, that mothers that breastfeed their babies exclusively for 6 months and continue for up to 2 years, they are found to be much, much healthier.
Okay. I like the fact that you're talking about all of this now. Before we talk about this COVID-19 period, now
Yeah.
they're lactating mothers, before you get to start lactating and all of that. It's some say at that period when you've just been given birth to, they do that practice of giving the the baby maybe formula, or at that particular point in time, just before the mother gets to lactate. Now take this simultaneously along. What has been the effect of exclusive breastfeeding, looking at the times we are in right now, talking about COVID-19 pandemic?
The impact, of course, of exclusive breastfeeding, as I said earlier, it benefits the baby, for healthy survival of the baby, for healthy growth of the baby, and for development of the baby, especially the brain development. It benefits the mother also. Mothers that are known to breastfeed also have lower cases of cardiac problems, that is heart problems, diabetes, and cancers. And also for the generality of the society. And today we are talking even about the planet. It promotes the planet. So one can say now with the pandemic, because
Right.
there's a lot of anxieties that mothers that are exposed or suspected to be COVID positive or infected with COVID should not breastfeed.
Right.
It is wrong. What we promote is mothers should continue to breastfeed their babies.
Regardless
But
if
they
you're
must
positive.
observe preventive measures.
Right.
They must observe all the preventive measures. Wash their hands, sanitize their hands, protect their face with the face cover or the mask, and make sure before they do that and they continue to breastfeed their babies. We've had mothers during this time of the COVID that are COVID positive, and they continue to exclusively breastfeed their babies.
Right.
It has not shown transmission, evidence transmission from the breast milk to the baby, with the observation of all the preventive measures.
All right, Dr. Samuel, before I allow you go, they say behind every successful man, you have a woman. No, the reverse is the case now. I assume for a successful woman now who is breastfeeding, what's the role of a man, as regards exclusive breastfeeding?
The man is a strong supporter.
Right.
To the mother. And then we also support and then continue to encourage greater involvement of men, as advocates, as strong supporters for women, as strong mobilizers, to ensure that babies are exclusively breastfed within the first 6 months of life. And it doesn't stop after 6 months. Mothers should continue to breastfeed for babies up to 2 years, and even beyond if they want to continue.
Right.
But remember that they have to introduce complementary feeding after 6 months, and then continue with breastfeeding and the complementary feeding. So, of course, just like what you've said, men plays a very significant role. And at this point, I would like to also mention that men as policy makers, as religious leaders, as community leaders, they have a very significant role to play. And they are already playing that role in some communities. But we want them to see that, we want them to be more proactive in encouraging breastfeeding, and they have a role in providing the right policy environment, legislative environment. They have a very significant role also in providing enabling environment, privacy, especially in workplaces, in marketplaces, where women can step aside and isolate themselves to be able to breastfeed their babies wherever they are.
All right, Dr. Salma Ibrahim Anas Kolo, many thanks for coming on the news at 7 and for sharing your insights.
Thank you very much.